You've been looking at children with Down syndrome. Now, what was the issue that you were trying to investigate here? What was the problem you wanted to deal with?
Right. So there's a lot of different studies that we have in literature so far telling us about different interventions that physical therapists have tried. Some have worked. We have some good literature, but it seems that physical therapy practice in the treatment of kids with Down syndrome is very variable from therapist to therapist. So this study's aim was to get an idea of what those PT-related problems physical therapists are seeing in kids with Down syndrome, and then what are the interventions that they're doing. And then alongside that, we also took a look at what are the outcome measures that physical therapists are using, what are some novel interventions that they're using, and what are interventions that they're using that may not have they may not have resources to
Now,
access.
this is a big study because you sent out an awful lot of questions to a lot of people. What exactly did you do and what did you find?
So we sent out a questionnaire through the APTA, APPT registrar, and that survey had those 6 questions that I just mentioned in it. Then when we got the results back, we pared it down by sorting out the PT-related problems and interventions by category so that we would be able to analyze the data. And then from there, we compared both on a categorical level as well as a ICF level, what types of problems and interventions we're seeing. And that gave us insight into if those categories are the same at initial evaluation and during treatment, and then what areas of research need to be further explored.
Could you tell me one or two of the key things that came out of it then that you really noticed?
Definitely. Yeah. So one of the most helpful things for me as an early professional in this field is how detailed this study goes into the different exploring what PT-related problems and interventions physical therapists identified. So I think it was really helpful in compiling a lot of that evidence into one place. There's not a lot of detail on each one, but it gives resources to how to access that information down the road.
Can you give me an example of something that would be really useful then?
Yes. So, for example, functional motor skills was one of the most reported categories. And that's really good to know that physical therapists are seeing this and treating this, because we know that functional motor skills impact participation and cardiovascular activity, impact cognitive development. So it seems like it is a really identified area of concern and also a highly identified area of intervention.
Did you find that there was a consensus among physical therapists about how best to treat children with Down syndrome?
Well, the consensus that we did find is that functional motor skills is a high concern, as well as muscle performance and joint stability and alignment. Those 3 categories seem to arise quite frequently among the responses, but it also displayed that there is a lack of consensus about the other areas. And that may be because in Down syndrome, we see musculoskeletal and neurological impairments across the board in all kids with Down syndrome. But then the other systems that involved are highly variable. So some children will have cardiopulmonary issues, some endocrine, and it's all over the map. So this leads the physical therapists to sometimes be treating cardiopulmonary problems, sometimes addressing their cognition, sometimes addressing balance or neuromotor control. I think why we see such variability.
When it came to the actual techniques used, did you find there was this kind of pooled wisdom about what to do in particular situations? And could you perhaps give me an example?
So again, the only ones that had a consensus were were working on gross motor skills for participation. We did see quite a few unique interventions defined by the therapist, and that would include sometimes using stability, wear, such as Theratogs or Speos, were some of the ones mentioned. We also saw use of HIPAA therapy, which is a more novel intervention.
Clearly, it's a diverse area. I mean, was it possible to get anything that really floated to the top, do you think?
Yes, yeah. So 22% of our responses were functional motor skills, 18% were joint stability and alignment, and 15% were muscle performance. So just out of those three categories, that is the majority of the responses. From that, we were able to look then at the evidence and see maybe why are physical therapists treating most in these categories. And I believe that is because we have the best evidence in those categories. So we have studies that tell us that progressive resistance training is effective in kids with Down syndrome, and treadmill training leads to early walking, jumping skills, results in greater strength. So I think when physical therapists have a really good idea that the evidence is going to have a successful result, that's the areas we're more likely to treat in.
What about outcomes? Were you able to correlate techniques with outcomes and find out about the efficacy of treatments at large among your survey completers?
Yeah, so there were quite a few outcome measures that physical therapists used. Among the most common were the PDMS-2, the BOT-2, the AIMS. And the good news is we have good reliability and validity for those outcome measures. There was also some newer outcome measures that we do not have research to support, and that was kind of a theme throughout the whole survey. Is there are some core things we do have good research for, and then there's a lot that physical therapists are doing that we don't have evidence for. And that is primarily because a lot of pediatric physical therapy research in this area is pilot studies, and we don't get into the deeper research.
Now, what's your feeling then about what needs to be done? This is a very broad canvas. You've done some pioneering work collecting huge amounts of data. What actions do you think could be taken?
I would love to see a CPG on Down syndrome, just like the excellent one that just came out on torticollis. I think seeing this evidence all compiled is a great first step in seeing what areas we need to dive into further, and build off of that.
From your knowledge then coming out of this, what do you think are some of the practical ideas for physical therapists around the world when they have a child with Down syndrome? What do you think should be the first actions, and how should they approach this patient?
So this study doesn't directly tell us how we should be treating. It just shows us what we are doing currently. From my perspective, in looking at what problems we're seeing and what interventions we're performing, my big takeaway is that I need to be super clear in my initial evaluation. What are the key areas of concern that I'm pulling out? And then making sure that I have direct interventions to treat those impairments. Because we did see at the level of the ICF that many therapists are seeing concerns at the body function and structure level and treating in the activity and participation level. And that can lead to malaligned therapy goals. So for me, the big takeaway is directly treating the impairment level and activity level and participation level concerns that I see.
Do you see clinical practice guidelines coming down the pike sometime then?
That is my hope. That was the goal of this study, was to create a base for future clinical practice guideline. And I've been really encouraged by the most recent ones we've come out with the APTA. So the one thing that really stuck out to me about what we saw as far as problems and interventions was that cardiopulmonary dysfunction was reported 6% of the time in problems, but in interventions, it was only mentioned 1% of the time. And this just raises concern for me, knowing that physical therapists can have such a big impact on children with Down syndrome and their cardiopulmonary health. We have studies from 2005 that say 3 times a week for 30 minutes of low impact exercise can reduce respiration rate, it can reduce heart rate, it can build cardiovascular endurance. So I just want to express that from this finding, we're seeing that we're under treating cardiopulmonary concerns in the Down syndrome population.
Do you think then that a program of looking into exercise and dosing of exercise would be worth doing right now?
Yeah, so we actually do have some of those studies already done. It looks like just in the treatment of children with Down syndrome, it's not practiced as much as we're seeing evidence for it. And this may be because physical therapists are addressing that component and maybe just didn't have it in the survey because we gave 5 responses instead of all of your responses. And maybe it's because physical therapists are treating with strength training or other activities that build endurance. However, we are under treating cardiopulmonary.
And given your own special interest in cardiopulmonary health, what would you recommend, do you think, in terms of a typical patient with Down syndrome and the sort of exercise program you could generate?
Yeah, so I think it's something we can incorporate into almost every physical therapy session, just finding ways that these kids enjoy exercise, figure out what makes them move, what's interesting to them, really emphasizing tying in with community-led programming where they can get aerobic exercise on a regular basis to meet those cardiopulmonary goals.